So my name is Shawn Johnson East. I competed in the 2008 Olympic Games as a gymnast, and we are going to be talking about exercise while pregnant today.
Hey y'all, welcome back. Mama Dr. Jones, ObGyn, and Mom to 4. Today is a super exciting day because we are talking to Shawn Johnson about exercise in pregnancy. I, for one, am thrilled about this because as a former elite gymnast myself, I'm kidding. I competed gymnastics as a junior high kid. And of course, I was nothing like the amazing Olympic gold medal status of Shawn Johnson. But for that reason, and many others, I am just so thrilled to chat with her today about her experience being pregnant as an athlete, if she got any backlash online, because that's something I see all the time in people online who are elite athletes, and just if she has any questions for us about exercise in pregnancy. Before we jump into that interview, I'm going to just talk a little bit about exercise in pregnancy, general guidelines, and information for you all. I am asked about exercising in pregnancy all the time. I want to go through some of the risks and benefits of exercising while pregnant. Let's start with the benefits. Being active and exercising during pregnancy has been shown to be associated with lots of great things, like reduced risk of gestational diabetes, less pain and aches throughout the pregnancy, a higher chance of having a vaginal delivery and a lower chance of having a C-section, less hypertension, which is high blood pressure, and maybe even a lower risk of postpartum and perinatal depression, as well as just a general quicker recovery after you deliver your baby. For these reasons, we recommend an exercise program in pregnancy for almost every single patient. Now, there are some reasons that we would not recommend this. For instance, if you have a high-risk pregnancy because you have a placenta previa, or you've had bleeding throughout your pregnancy, or your doctor has said you are high risk for an extremely preterm delivery, a lot of these are reasons that you may not want to exercise in pregnancy. But this is very individual, and I would say, as an OBGYN, I rarely see someone who can't do any exercise while they are pregnant. Even patients who weren't doing an exercise program before pregnancy can talk with their doctor about what is a safe way to implement exercise and to carry that on throughout pregnancy and after. So these are all good things. Being active in pregnancy is a good thing. One of the more common questions I get, okay, well, what is okay and what is not okay? For the most part, in people who are just normal day-to-day people, as in not elite athletes like Shawn Johnson East, you can pretty much do whatever you were doing prior to pregnancy that doesn't cause you pain now. You just need to listen to your body. Your body will tell you what modifications that you need. Your center of gravity is going to be altered, and so you have a little bit different balance. The biggest thing is that actually the person who's pregnant is at slightly increased risk of injury. And so we just want to be sure that we're taking into account our changing bodies while we're exercising. Does that make sense? For specifics, if you have something you love to do and you're not sure if it's okay to continue doing it, I would talk to your doctor because this is very individualized. So the blanket recommendation is exercise in pregnancy in the absence of risk factors which make you unable to exercise in pregnancy is a good thing. There are very few risks to standard exercise programs and tons of benefits. People can even continue running a lot of times in pregnancy up until the point where they feel uncomfortable with that. So the biggest thing here, like I've said already, is listen to your body. Warning signs that you need to modify or stop exercising would be if you're having consistent contractions, of course, if you had any bleeding or you thought your water broke, dizziness, headache, chest pain, any of these things, you need to stop what you're doing and talk to your doctor about what happened and what kind of modifications you might need to make. And now I am so excited to welcome Shawn Johnson East to the channel to talk about exercise in pregnancy as an elite athlete. Shawn also just got over having COVID while she was pregnant, and we did a video on her channel answering some of her viewers' questions for me. So after you watch this one, hop on over and check hers out. Thanks for being here today, Shawn. Can you introduce yourself, even though I'm sure that everybody already knows who you are?
So my name is Shawn Johnson East. I competed in the 2008 Olympic Games as a gymnast, and we are going to be talking about exercise while pregnant today.
Yes, I'm so excited to talk to you because this is something in my video just before we got on here, I explained kind of the basics of exercise in pregnancy, but I think that something I see a lot is people who are pregnant and who are athletes, especially elite athletes, are high-level athletes, get a lot of criticism online. So I was interested if you had an experience like that in your first pregnancy, or for those who don't know, you're currently pregnant now in this pregnancy.
Yes, it's probably a daily thing. I probably get criticism every day for something that I've done physically while pregnant or even postpartum sometimes. And I remember during my first pregnancy, it was kind of hard to digest just because within my first pregnancy, I didn't know what was right. I didn't know what was wrong. I didn't know if I was doing too much. You kind of just go by what your doctor's telling you. And I knew I was following my parameters based off of my doctor. But with so much criticism, it kind of makes you doubt. So with this pregnancy, I've been working out. I've been following kind of my doctor's guidelines. But yeah, we get a lot of criticism for it. And I feel like people are very torn as to whether they're pro exercise or not.
It's really interesting because the medical community is torn on a lot of things, but exercise in pregnancy isn't one of them. We pretty much across the board say this is a very beneficial thing. There are huge benefits and almost no risks as long as you're not in a category who is an unusual category who shouldn't be working out, which is pretty rare. Do you mind sharing maybe an experience of something someone said to you? Because you bring up a really good point there is like, I knew I was doing what my doctor told me. I knew I felt good doing it. But still these people that I don't know can creep in and say things that really affect how I feel or make me second guess what I'm doing. So do you have a particular experience with that?
Yeah. So I think the hardest thing for me, for like what I personally had to kind of digest and work through was we miscarried 2 years before we gave birth to my daughter. And within that pregnancy with my daughter, I knew I was following protocol of my doctor. I was still working out. I was still lifting weights. I was still running, getting my heart rate decently high, but nothing that I wasn't used to. And I would do handstands. I would flip on a trampoline, all these things that my body was so comfortable with. And I remember reading comments and kind of getting backlash from people saying that I was going to cause another miscarriage and that I was going to be the reason I lost another baby and I would cause harm to the baby. And I would just, it was all the things that I had to kind of work through. It was all harm intentionally caused to our child. And I think the hardest part for me was trying to weigh what I knew in my heart was right, which was following my doctor's protocols, knowing I was doing things the right way, knowing my body felt good, and that doubt that what if I could be doing something bad. So I think that was the hardest part for me.
I really hate that because it's so predatory. It's so predatory for somebody to come online and say either you caused something to happen last time or you might this time, when we know scientifically that there's no evidence that miscarriages are caused by exercise. None. We've looked at that. And it makes me sick. And I don't know if people do it thinking they're actually doing something good or if they're actually just horrible people, but that is a terrible thing to tell somebody. I'm sorry that you went through that. I mean, having a miscarriage is incredibly difficult as it is. You don't need people weighing in with their unsolicited opinion.
I mean, I honestly truly feel like going through the whole pregnancy process and then having a kid, and I'm sure you go through this too, it's just, I feel like people are so passionate to protect children, which is such a beautiful thing, that it comes out aggressively.
Yeah.
And I think when you have to, like, if you take a step back and you're like, okay, I know they mean well, but I know they also don't understand that on the backside, on my side, I'm going through so many phone calls with my doctor and showing her my workout protocols and making sure everything I'm doing is safe for my pregnancy.
Absolutely. And who else would want to protect your baby more than you? I mean, it's, yeah. So, all right. Well, I'm interested to know I'm assuming that you did change your exercise routine a little bit pre-pregnancy and after. So I'm interested to know, just out of sheer curiosity for me, what you were doing prior to pregnancy and how you changed that with the help of your doctor in pregnancy.
Yes. So outside of pregnancy, especially after my daughter, I felt like my entire workout regimen had a goal to it. So it was constantly trying to get better, get back to that healthy pre-baby weight, make sure my abdomen was back. I had a little bit of that diastasis recti, so I had to work on getting that not fixed, but healed. Just trying to get my strength back that I felt I had lost while pregnant. And so during those workouts, it was always trying to push myself, trying to go past what I did the day before, trying to get my heart rate a little higher, lift a little heavier weight, run a little longer. It was always trying to kind of push that boundary. And then with Drew's pregnancy, and then with this one, as soon as I get pregnant, I kind of rein it back in. So instead of working out with a goal to get better, I work out with the goal of just maintaining and staying active and healthy and just fit. So whatever I did yesterday, I'm not trying to beat it. I'm just trying to kind of stay right there, if that makes sense.
Yeah, that makes sense. And it's actually really good advice for anybody who comes into pregnancy with a pretty decent workout routine already. You know, the biggest things are we want you staying hydrated. We want you listening to your body. If your body says you need to alter what you're doing somehow or make some kind of difference in your routine, then you should do that. And we want you taking note of your weight and making sure that you're not losing weight or that you're kind of staying on track with your calorie intake goals and stuff like that. So I think those are really good, you know, information for people who are watching this, who are more than just the average exerciser like me and want to know like what I should do in pregnancy. How do you feel like being an elite athlete changed how you approached pregnancy or you approached exercise in pregnancy?
I think with my first pregnancy, it made me very obsessive. So I saw it like a competition almost of what's my new diet, what's my new workout regimen, what's my like goal that I'm going for. And it kind of just became a game in a good way, and I really enjoyed it. So I would read up on diastasis recti, and I would read up on core workouts and workouts that could potentially help with delivery and just anything like that. So it was definitely like a training regimen, kind of like I was back at the Olympic days. This pregnancy, now having a toddler, it's kind of just try to work out and stay sane at the same time. I worked out at 6 a.m. this morning because it was the only time I had, and again, your goals just change. And as the former athlete, I know that I feel better, especially pregnant. I feel better working out. I feel healthier. I feel like I have more energy. My body doesn't ache as much. So I have that goal each day of getting something in, but I don't have time to obsess anymore.
Yeah, toddlers definitely take that away from you in a lot of aspects. You brought up diastasis recti, and for my audience who's watching, diastasis recti is where the abdominal muscles kind of move apart in the front. And this is a normal occurrence in pregnancy. It's something that has to happen to give space for the baby to grow. But what happens is after baby comes out, it takes some time for those to go back where they need to be. And in some people, it never goes back where it needs to be. Most people it does, but it does take time. And you're exactly right that there are exercises that you can do to help with that after delivery. And if people have persistent problems, then they should come in and chat with us about it so we can check it out. But I usually encourage people to give at a minimum 40 weeks because that's how long it took to get there before you plan for your body to get close to back where it is. So just be kind to yourself and let that happen naturally. Anything else you want to add? Any questions you have for me about exercise in pregnancy or anything you want the audience to know?
I would just say it is funny that we're talking about this because I literally had an old teammate of mine from like back in elementary school and high school text me the other day. She's pregnant and she has an OB who's very old school and not to raise her heart rate over 140, make sure she doesn't lift weight, make sure she rests as much without a high-risk pregnancy. I would just say, like, what causes people to go that route and what are the go-tos of what you're allowed to do and not allowed to do?
I think a lot of this comes from exactly what you said, kind of old school subscriptions to things we used to tell people without really a lot of basis. Pregnancy used to be viewed as like a very delicate state where anything you did sneezing wrong could cause major problems. And the more we've researched this, the more we've figured out your body, shockingly, was made to do this. And you have a lot of reserve to protect the baby. And it's okay for the most part to continue doing whatever you're comfortable doing. with some few exceptions. Obviously, I would never tell someone to go against what their doctor's telling them, but I do know of those recommendations, and they are not things that I choose to tell my patients just based on the scientific evidence that we have about the massive benefits to regular exercise during pregnancy.
I think the other question I had is, I feel like something that I get a lot from people is and I know this is, I feel like I would know the answer, but like, how do you know when it's too much or too much weight? Can you lift weight? Can you run a marathon? Can you know?
Yeah, so the answer for some people is going to be yes, you can do it. And for some people, it's going to be no. And I think I've said this probably 100 times in this video before I got to here to talk to you, and also probably several times since we started talking, but you have to listen to your body. Of course, there are things we shouldn't do while pregnant. I mean, I probably, if I were your doctor, would be like, no, we probably shouldn't be doing like long tumbling routines where you have a change in your center of gravity and you could fall. But at the same time, if you're super comfortable doing a handstand because you don't fall doing handstands, it's probably safe for you. Most of my patients probably shouldn't be doing handstands though, right? So like these recommendations change based on the individual, and that's so important. But if someone's just watching and trying to figure out, what's okay for me, what I tell my patients is anything you were doing prior to pregnancy that doesn't cause you pain now is probably safe to continue.
And then one more question. I had this really weird thing during my first pregnancy where I swear it was, when did the walking thing start? Like second trimester, mid-second trimester? Yeah. But even walking, my belly would cramp so hard that it was painful. And I literally couldn't go for a walk, but I could go lift a weight, or I could do like a high intensity workout, but I could not go for a walk.
Yeah, I mean, that sounds like probably some Braxton Hicks contractions. And the idea most people have in their head is Braxton Hicks contractions aren't real and they can't hurt, but it's not really true. They can. The only difference between Braxton Hicks and regular contraction is your cervix doesn't change with a fake or Braxton Hicks contraction. So that's what that sounds like. Why it happened with walking and not other things, I don't know that I can tell you the answer to that, but you really touched on the important thing there is I figured out things I could do that didn't cause that and allowed me to continue working out like I wanted to.
I remember that being I would get so frustrated because I was like, I just want to go for a walk. And my belly would just start hurting.
And it's pretty common, like Braxton Hicks, when you are walking, especially kind of longer distance walking, it's pretty common. So I'm glad you brought it up because I think there's probably a lot of people who have experienced that and wondered what it was. All right, well, if that is all, I am so happy you were here, and I'm so happy to make this video and raise some awareness about exercise in pregnancy because it's something I see unfortunately addressed in very bad ways online all the time. If you ever get mean comments, feel free to send them my way because I will stand by you any day.
I will.
You want to tell my audience real fast where they can find you?
Oh, yes. You can find me on YouTube at The East Fam, or on Instagram under Shawn Johnson.
Thank you, Shawn, for being here today. I am so thrilled to chat with my audience about exercise and pregnancy. And if you want to hear more about Shawn's experience with COVID and pregnancy and her audience's questions for me, you can hop on over to their channel and watch our video over there. Thanks for being here today, y'all. If you're new and you want to subscribe, we would love to have you. We talk about all things pregnancy, gynecology, periods, parenting, and so much more. If you just came to watch this video because you love Shawn Johnson East, I can't say that I blame you. If you'd like to check out another video, I will link them right over here, and I will see you next Monday.